Welcome to the Protecting Your Nest podcast. The R in the ROPE acronym reminds us to focus on having healthy relationships. Now, there are many components to healthy relationships, but one that many of my patients have concerns about is their sexual health. Interesting enough, it's not just the guys who enter my office for advice in this area, but the ladies as well. Unfortunately, most conventionally trained docs like myself have only been trained to treat erectile dysfunction with invasive or painful procedures, or have the barrier of pricey pharmaceuticals as the only solutions. Docs also have not been trained to address the root cause of this condition. This podcast goal is to help you identify root causes of disease so that you are equipped with the tools to help you achieve your health-related goals. Now, GAINSwave, for example, is an all-natural and completely non-invasive treatment for ED that uses high-frequency shock waves to enhance male sexual function, performance, and overall health. These treatments promote regenerative sexual health, which help men to naturally regain the function they previously believed they had lost forever. Today, my guest is Dr. Tracy Gapin. Dr. Gapin is a physician, entrepreneur, and leading expert in male performance optimization. Dr. Gapin is board certified by the American Board of Urology and is a fellow of the American College of Surgeons. He is a leading GAINSwave provider and has founded Sarasota Prostate Care in 2014 to provide an MRI-targeted fusion biopsy and HIFU for prostate cancer patients. In 2017, he founded Smart Men's Health, focused on optimizing male performance. He offers a personalized path to helping men maximize sexual health, testosterone levels, and prostate health. He also is the author of Male 2.0, Cracking the Code to Limitless Health and Vitality. And I really just wanted to bring him along to help us understand, what is it that we do in clinical practice when people have questions about ED and we only have those limited options. I felt like a doc who understands some homeopathic approaches or approaches that are different would be very helpful. So I really appreciate him coming to the podcast. And with that, Doc, I welcome you to the Protecting Your Nest podcast.
Hey there. Thanks so much for having me today.
Absolutely. And before we begin, and by the way, most men are very interested in this topic, but I think our ladies are as well. And I'm always surprised, as I mentioned in my initial comments, how common it is that the wives will come in and ask questions, and the guys are kind of, not shocked at all that they did, but it's one of those things that the ladies start the conversation with. So I'm really excited that we do have some options beyond traditional options. So let's talk a little bit about who you are and what led to your focus on men's health.
Oh, yeah. Thanks so much, Doc. So I am a board certified urologist. I've been practicing urology now for 23 years here in Florida. And I've seen it all. When it comes to men's health, I spent a long time treating men with prostate cancer. I was doing the big operations using the Da Vinci robot. And then I got into more of the cutting edge technology where we're able to use MRI to really precisely identify and localize prostate cancers and then treat them in a minimally invasive approach. From that, I really have evolved over the last, I'd say 8 to 10 years now, Tony, where I've come through my medical practice to really recognize that this disease model world that we're in is really failing, and it's failing our men. We are experiencing what I call a men's health pandemic, a crisis that's getting no attention, and I don't really know why. Testosterone levels are plummeting, cardiovascular disease is rising, obesity is rising, sexual health is deteriorating. And for the first time in decades, our lifespan is actually decreasing. And there are a lot of causes, which I'm sure we'll talk about, but you bring up a really good point that so often it's the women who will provoke the men to finally seek out attention. And so my passion, my emphasis, my focus is to help men take control of their health, decide that they're no longer going to be a prisoner to the medical system that only treats symptoms, stamps out disease, and instead focus on optimization.
Yeah.
And so, sexual health it's really
Mm.
a key marker. A lot of people think that it's just about sex, but it's so much more than that, because sexual health is critically important for a relationship. And it's a sign of our vascular health, it's an indicator of our internal vascular system, of our hormone function, of our metabolic health, of so many aspects of our physiology. It's a window, if you will, into our health. And so sexual health is really critical when we look at men's health.
Yeah, and I do a Facebook Live, which I'll be doing tonight of this recording with Congressman Danny Davis. One of our co-hosts is Dr. Terry Mason, and although I'm a low carb guy and he's more of a low fat guy, he talks about he was a urologist also. He's retired now, and he says it's the canary in the coal mine. It's like it's just that warning that Houston, we have a problem, and it's not just down there. It's probably everywhere. There's vascular disease. So totally get that. And speaking of, how common it is, how common is erectile dysfunction? I have so many guys coming into my practice with their wives, sometimes without their wives. And it seems like a lot of people, I mean, I'm 53, and it seems like somewhere between 45 and 55, you start hearing people showing
Mm-hmm.
concern. That seems so
Yeah,
young. So what's your
yeah,
thoughts on how common it is?
yeah. Great point. And if you look at the quota statistics out there, I would tell you that they're likely underestimating the problem, because what happens? A lot of guys, they don't say anything. They don't want to get attention. They're embarrassed. I see so many who are frustrated by it. They're embarrassed by it. They don't know what to do. And so they just go about their lives and they pay no attention to it until their wives finally say, hey, you should be chasing me. Now I'm chasing you. What's up? And so when it comes to estimate the number, I typically say that your age is about the percent likelihood that you're going to have erectile dysfunction, meaning about 50% of men age 50 have some degree of erectile dysfunction.
Now, what's interesting, I also can say as we age, things are different, and we're not 20 anymore. We're not 30. So I think it's important. You mentioned relationships earlier, right? And when you're in relationships, I think it's so important that men and women know what to expect. Now, we're not expecting things not to work, but they may not work the same. So, are
Mm-hmm.
there some things you can say that men and women can hear about what normally happens as we age that
Yeah.
may not be that abnormal? It's just different.
Mm-hmm. Yeah. So a lot of men will struggle with transient or intermittent issues with sexual performance. And I want to emphasize that that's a very common thing, and that's actually normal. That's actually healthy. That's okay for a man to occasionally have those issues. But what happens is they get in their own way.
Mm,
So this is the vicious cycle that we tend to see a lot of, and I'm sure you see this in your practice as well.
yeah.
A guy will have trouble one night, perhaps because he was out drinking too much, or perhaps he's too stressed about work, or he's distracted about finances, or whatever other social issues may be going on in his life, or health issues, which we'll talk about. But for whatever reason, tonight he doesn't perform at his best. He's embarrassed by it. He's frustrated, obviously. He's a little insecure about that now because he didn't take care of his partner. And so the next time that it's time to get intimate, you know what he's thinking about. He's thinking about the last time.
Mm,
And now he's so preoccupied and worried with, how am I going to perform? Is it going to happen again? Am I going to be okay today? Is it going to work? Is it not going to work? What's she going to think of me? Is she going to love me? Am I a man enough? All these things are going through a man's head when he's fine,
right.
when he's totally fine. And this is just a normal thing that happens. And so getting men to recognize that imperfection is okay and that those sorts of things happen is really important, so that you can get out of your own way and simply enjoy it. Now, that's not true erectile dysfunction in that sense, because that's just simply a transient event that tends to occur when other times you're functioning okay. And that, again, that's normal. When guys have trouble where they can't perform on a consistent basis, now we're talking about erectile dysfunction. And now we got to look at the causes and the solutions of that.
All right, cool. Yeah, it's the mind. I think about my NEST acronym, and the T is for recovering from trauma. That's almost like a trauma when things don't work. And then the other T represents how we think. And I know that how we think can have a huge impact on our bodies. So I think it's important that we have some sense of how powerful our minds are. And I think any man listening and any woman listening understand the power of words and your previous life experiences and how they can define us. So that's very important to point out. So you kind of hinted that we would mention something about some of the health issues that can lead to ED. I kind of suggested that
Yeah,
ED is a canary in a coal mine, but I think there's some health conditions that can lead to ED. What would you say about that?
exactly. Yeah. So when a man has ED, especially a younger man, you want to start thinking about the underlying causes of it. And one of the most common causes of ED is poor blood flow, vascular disease. So let's back up and talk briefly about what is an erection. So for the listeners who may not understand this, an erection is simply increased blood flow. So you get your blood vessels that come to the penis that will open up or dilate to allow increased flow of blood into the penis. The arteries dilate. And when those arteries dilate or open up, more blood comes into the penis, and that blood actually compresses the blood from leaving. And that compression of the veins prevents blood from leaving, and that is technically how you get an erection. And so anything that might affect the blood flow coming into the penis is going to affect your ability to have a good sexual performance or erections. And so when we look at vascular disease, when you start to get atherosclerotic disease or plaque buildup in your blood vessels, where your arteries start narrowing, if you want to call it, from plaque buildup and from cholesterol and inflammatory deposits in the blood vessels, that obstructs flow. The blood vessels to the penis are much smaller than the blood vessels to your heart.
Yeah.
And so this is important because it's often an indicator. The canary in the coal mine is an indicator very early on of vascular disease. And so I can't tell you how many men I've seen who are in their 40s and 50s who have ED, and I put them through a cardiac workup, and they actually have fairly significant cardiovascular disease. And so you want to catch that early so you can manage it and address it so you don't drop dead from a heart attack one day at a very young age. So blood vessels and blood flow are one of the most common causes of erectile dysfunction. And so anything that we can do to improve blood flow is definitely going to help erectile function. And when we get to treatments, that's why, treatments like GAINSwave and PRP, for example, are so helpful at improving and restoring good, healthy blood flow.
Awesome.
Yeah. The other thing to be aware of is insulin resistance. It has a marked effect on blood flow. So how do those blood vessels that I mentioned open up? How do those arteries dilate to allow increased flow? Well, they do it through a hormone called nitric oxide. It's actually a hormone. And nitric oxide causes vasodilation or increased blood flow. Nitric oxide is in nitroglycerin. When you have a heart attack and you go to the ER with a heart attack, the first thing they do, they give you a sublingual or below the tongue nitroglycerin tablet because it has nitroglycerin and it makes your blood vessels dilate and can hopefully save your life. And so insulin resistance, which means poor control of blood sugar, is an early stage of diabetes, if you will, is a critical cause of low or poor nitric oxide function, which contributes to poor blood flow to the penis. And so controlling your nutrition and your activity and your stress, which affects your blood sugar regulation, your insulin level regulation, is really critical as well, because another key cause of ED is metabolic health, or poor metabolic health.
Wow. Well, if you go to drtonyhampton.com, you see metabolic health. The first thing you see. So you're preaching to the choir. I think a
There you
lot of the
go.
people
That's
listening
right.
to this podcast completely get it. And man, I tell you, so many things that metabolic syndrome, insulin resistance, and obviously cardiovascular disease. It's all like a big bucket of bad things that can harm us. So thank you for that. It makes a lot of sense to me, and I'm sure to a lot of people listening. So, and speaking of my website, many people who follow me on my podcast tend to lean towards carb restriction, metabolic health as a way to achieve their health-related goals. Although this is our focus, I'm always looking for different perspectives, broader perspectives. Again, that's why I'm on, Couch Conversations with the Doctors with Dr. Terry Mason, because he has a different perspective. But I think we have to have all of that in our toolkits because of bio-individuality, and what I do may not work for the next person. So I'm curious your thoughts on diet and lifestyle behaviors that you've seen in your research that has really helped men be successful with their sexual health.
Yeah, great, fantastic question. So this ties into my overall approach to men's health, and I've coined it the Gapin Code to men's health. And the Gapin Code really has two facets to it. One is a data-driven approach, and one is systems-based. So when we look at data-driven, we're looking at what data points can we use to guide us to take what I love how you eloquently called it a bio-individualized approach to health, or how can we identify what's right for each individual man because we are uniquely different. And so first of all, look at genetics. Genetics have a critical effect on how our body responds to our environment, to our nutrition, to our sleep, and so on. So for example, you could look at genetics related to nutrition, and there are a lot of proponents out there of keto diet, for example, a low carb diet. And in fact, there are actually genes like PLIN1 gene, for example, that dictates how your body responds to carbohydrates. And so some men will actually lose weight with higher complex carbs. And complex carbs are like quinoa, broccoli, sweet potatoes, oatmeal, all the good healthy carbs that are low in the glycemic index. So I'm not talking about cakes and candies and that sort of thing. So I want to be clear about that. But the key is that this is where you can use genetics to really understand what's right for you. Your genetics can help us understand why you may be overeating, or how much protein might be good for you, or looking at sleep, whether you have issues with sleep disturbance, which, sleep has a dramatic effect on cortisol and insulin and testosterone and ultimately sexual function. We can look at genetics related to detox and how our bodies produce antioxidants like glutathione, and how can we optimize that, and what micronutrients might you have a risk for deficiency of. So we can look at all these aspects of genetics. I'm also a huge proponent, Tony, of wearable tech. So when we look at data, tracking your data is paramount. So if you can measure it, you can manage it, I like to say. And I look at things like tracking your stress levels using Garmin or Whoop or Aura, and tracking your heart rate variability, which is called HRV, which is a direct indicator of your physiologic stress level, your internal cortisol, so to speak, of how your sympathetic and parasympathetic nervous systems are balanced out. And so that can give us a real clue into how your lifestyle and behavior is affecting your internal physiology and how your body's behaving. And using wearable tech is how you can really individualize care and understand what's right for you may not be right for me, and so on. I love CGM. So all my clients in my Male 90X high level program who work with me, they all use CGM, which is continuous glucose monitoring. And I know you as a huge proponent of metabolic health are familiar with it. That CGM enables my clients to track their blood sugars minute by minute, and they can correlate that with what they've eaten, what have they drank, their sleep, their behaviors, their exercise, and see how those are affecting our blood sugar. Remember, insulin levels and insulin sensitivity is critical when it comes to losing weight, maintaining sexual function, maintaining vitality, and actually longevity. And so I'm sorry to go on so long about this, but I'm passionate about this approach. Data-driven approach is really critical. So using your genetics and using wearable tech to really individualize care.
No, that's exactly why I framed my question the way I did. I wasn't sure what your answer would be, but what I do know and what I've learned in my nutrition and functional medicine training is that your genetics matter, but we're all different. And it's important that we are able to hear what you just said. I literally in class recently, there was a study that we looked at it was a randomized controlled trial. So it was a high quality study, and it compared like a high protein. I think the author was Moran, or it's Moran. I remember that much. And it was a high protein diet versus a high carbohydrate diet to see the impact it would have on sexual health. And what they found is that they both worked. So it kind of goes back to, so maybe the people that it worked for were those guys you said that could tolerate more carbs. And then you had another group that maybe needed a different approach. And I think that's very interesting because we have to look at data, but we also have to be flexible. And I think that's really important. So thank you for, I always hold my breath when I ask questions like that. When you're a low carb guy, I say, what is he going to say? But thank you for that. Because again, I want my listeners to not be indoctrinated into any one belief and to do their own little experiment to see what works for them. Now, I heard that you mentioned the term, biohacking male sexual performance. I want to understand, what do you mean by that?
Yeah, and the term coined biohacking has gotten a little abused and it's become a little outdated now. But biohacking is really a phrase that Dave Asprey created years ago, actually, that really refers to what can you do to optimize your body's performance. What hacks or tricks can you do that will improve? And so we can talk for the next hour about the different types of biohacks that we can do. But when we look at sexual function, we're talking about how can we improve blood flow? How can we improve metabolic health? How can we lower stress? How can we improve our detox function? And, I mentioned the gap in code. The other half of it, I didn't want to go into too much depth because I wouldn't come up for air talking, Tony, is the comprehensive approach. And for that, we look at, my MALE framework, MALE. M is mindset, A is aging, which is cellular function and hormones and mechanisms of aging. Lifestyle is L, nutrition, sleep, and fitness. And then E is environment, detox, gut health, and immune function. And we can look at each one of those components of optimizing health and understand how they all play a really critical role in our body's function, which ultimately affects sexual performance. And so you mentioned this on the intro, and I'm glad you mentioned this, that, so many guys, they just come in asking for the blue pill. They think that's the solution. Hey, just give me the blue pill and I'll be out of here. I'll be out of your hair, doc. I had a guy in about a year or a year and a half ago. He was 320 pounds and you could literally barely find his penis hidden below all the fat.
Yeah.
And all he wanted was a Viagra pill. And that's where you have to really, take the time to educate patients, understand that it's not so simple and that you have to look at the big picture. And I know you adopt the same kind of philosophy that we need to take a comprehensive systems-based approach to optimizing men's health.
Yeah, I just clearly with the nest and rope acronym that deals with all of these root causes of why we get sick, it's a reminder that if we don't address those things, then you can't help people. And it's not that we didn't learn in our conventional training that lifestyle was important. It's just that we weren't taught, well, then how do we apply that? And it's almost like that kid that has epilepsy, and before we had medicine, we would put them on a diet that would help them. Now we just skip that part. And that's the horrible part about technology, is that we forget about the other stuff that was actually pretty straightforward and simple, and we go straight to the magic pill or the magic procedure. So I think it's really important that people always pause when they're faced with having to make decisions about what to do next. And as they collaborate with their clinician, always ask them, so is there something else I can do before I go to this step that won't harm me? And I think that'll be important. I did start the conversation a little bit about how men are kind of, when things start going south, they think it's over, and but this regenerative performance idea that we can actually make things better, that's a pretty profound thing that most men have never heard. So talk a little bit about how that's possible.
Yeah. I think it's important to bring up a study that you just reminded me of. This study that I think is pretty powerful. This was a study, the Fahey study, came out about almost 2 years ago now. 2 years ago, Fahey published a study where he looked at the biologic age of men. What is biologic age? This is a test that looks at methylation patterns on your DNA.
Mm.
Why do we care? What's the point? The point is that methylation patterns or marks on your DNA are a way that we can now objectively quantify our biologic age, our physiologic age, if you will. So, for example, I am 49 years old, but my biologic age is 42. That's based on how I've treated my body, based on my lifestyle, based on my behaviors, based on the toxins that I've been exposed to, etc. And you can track that. It's simply a blood test with a finger prick to measure your quote biologic age. So that being said, this Fahey study, they took men and had a control group, randomized study. Half the group got metformin, which is a prescription medication that's been around for 50 plus years now, used by diabetics for blood sugar management. Okay, metformin orally. DHEA, which is a hormone, which is a precursor to testosterone, and it's an oral supplement, a hormone, and growth hormone. Okay, growth hormone's a peptide. I love peptides. We could talk forever about peptides, but growth hormone was given as well. And we could argue that pros and cons of giving growth hormone, that's a different topic. Suffice to say, they got those three treatments. And they followed these men for a year. I'm getting to a point. I know this doesn't seem like I'm getting anywhere, but I promise you I am. At 1 year, the men who received these treatments were a year and a half younger than when they started. Now, that's a 2.5 year difference from the men who were in the control group. 2.5 year difference.
I'll take it.
It's amazing, right? Yeah. So coming back to your question, I want to frame it carefully for you. When you look at regenerative options, ways that we can reverse aging, people always say, oh, that's bullshit. You can't reverse aging. We have a randomized controlled trial with quantifiable, objective biologic aging as proof that we can, in fact, reverse aging. And so how do we do that? Well, we improve all the things we talked about. We improve our blood sugar regulation. We improve stress and cortisol in response. We improve our micronutrients. We improve all of our hormones. You know, I talk about going beyond testosterone because every other men's health doctor out there, all they do is focus on testosterone and Viagra. Well, did you know there are other hormones that are important as well, like thyroid and cortisol and insulin and DHEA and vitamin D and estrogen and on and on and on.
Yeah.
And no one talks about these other hormones. They always talk about testosterone. And so that's how you fix sexual health, is you focus on all the stuff that matters and reverse aging.
That'll work.
There you go.
As you're sharing this science, I think some of us are aware about metformin and some of the things you've mentioned, but I'm always hesitant because I'm not anti-pharma. My wife's a pharmacist, but I try to, but the science is what it is. So I'm very interested in longevity. I've had a longevity guest, and I think it's important that we look at data objectively. But before I ask you about GAINSwave, why do you think most clinicians are not aware of newer treatments? I mean, I wouldn't be surprised if some of my colleagues in your field are not always aware of, so why do you think that is?
Great question. Being a physician is tough, and I don't want to sit here and sing woe is me to, patients are like, yeah, whatever. I don't care about you. I care about me. And I get it. And that's fine. That's fine. That's fair. I get it. Everybody's kind of focused on their own interests, and I understand. But as a provider, we have 10-minute visits. This is disease model me. This is, I'm fortunate to be a recovering urologist now, where I get to really spend time with my men and really emphasize the proactive preventive approach to health that men need. But in my old days, my old 23 years of urology, we had literally 10 minutes to see you.
Yeah.
Say hi to you. How you doing? Pleasantries. How's the dog? How's the aunt? Do what we got to do. And then get the hell out of that room, document it, write our note, you know what it's like, and then get to the next one.
Right.
And so there's no time to learn new stuff. There's no time to learn new innovative treatments. It's all about, keeping pace on that wheel. You're a hamster on a wheel. And so it's disease model medicine that is controlled by the insurance companies, controlled by big pharma. And all you can do is try to keep up by increasing the volume and seeing more and more patients in less and less time. and there's sure as hell no time to start looking at regenerative options and new innovative treatments that are out there that are freaking amazing. But you need the time to be able to invest in learning about it, going to conferences, and educating yourself. That in my old world, there was just no time.
Yeah, the irony of your comments is, as a student in a master's program for nutrition and functional medicine, if I wasn't a student, I probably would struggle to keep up. I'm forced to keep up. Now, obviously, as I go into my low carb Twitter world and things like that, and we go back and forth, that forces me to keep up. But I agree, like, it's hard to keep up, and and people have the perception that doctors keep up, but they look at an abstract, don't even really know what the study was, how it was done. They just look at the
Yeah,
conclusion. People don't have time, so
yeah.
we need to pause sometimes so that we can make better
Mm-hmm.
decisions. But I agree with you. We never want to look at our colleagues and say, point at them, because the system is not designed to ensure they keep up. So thank you for that. And we're halfway, at least a little bit more than halfway through our interview, and GAINSwave technology is how I kind of started, and that's something you're very familiar with. So I want to just understand, what's this GAINSwave technology? How does it work? What sets it apart from pills and injections, and who should consider it?
Yeah, great question. So we talked earlier about the cause of ED, the numerous causes, but the most common cause is vascular disease or poor blood flow into the penis. An insufficiency of sufficient, a normal, healthy arterial blood flow. And so we look at ways of fixing blood flow. I like to look at this as two different approaches to erectile dysfunction or improving sexual performance. One is a Band-Aid, and one is fix the problem. And you have two ways to go. You can use a Band-Aid, or you can fix the problem. Which one do you want?
Right.
Band-Aids are things like Viagra, Cialis, Vardenafil, Stax, and all the other, they're pills. Basically pills that you take, and they're phosphodiesterase inhibitors, which means they increase nitric oxide locally to increase blood flow. That's how they work. Okay. That's one Band-Aid. Another Band-Aid might be a vacuum pump, okay, a penis pump. Another Band-Aid might be trimix injections or intracorporeal penile injections. This is where men will take for the listeners at home who may not be familiar with this, you take a tiny little needle, like we're talking 28 gauge needle, very small little needle, and you inject a small amount of medicine into the penis, and that medicine causes increased blood flow by causing vasodilation, okay, increased arterial flow into the penis. And that will cause an erection that will last for hopefully under 2 hours. You don't want to ever last more than that.
Right.
4 hours is an emergency, but under 2 hours is the goal. You do your thing, and it goes down on its own in time as the medication wears off. Those are Band-Aids. Those are like, hey, doc, I got to get it on tonight. My girl's waiting for me. I got to be ready.
Right.
I don't got time to wait. It's not working now. It's got to work in 2 hours from now. All right, well, those are the Band-Aids, if you will. But that's doing nothing to fix the underlying problem. And you're going to eventually get to the point where the Band-Aids work less and less effectively, to the point that they don't work at all. Okay, if you're not doing anything to address the underlying cause. And so again, I want to emphasize that the comprehensive approach to optimizing health, focusing on all the issues that we talked about, is paramount, and really, I don't want to lose sight of that. But what can we do directly to the penis to fix the underlying problem of poor blood flow? And that's where treatments like low intensity shockwave treatment, which is GAINSwave, is the brand name for that treatment that's well known, very popular, and PRP, which is platelet rich plasma. So what GAINSwave is low intensity shockwave therapy. And this is similar to the technology that I used for over 20 years treating kidney stones. It's shockwave treatment that's delivered extracorporeally. That means from outside the body, but it gets focused inside the body to a focal point. And so we would use this technology to treat kidney stones. It would break up the stone, and then the patient would pass the stone. But they realized that at very low intensity, that same technology has a very profound effect. It activates stem cells. Now, stem cells are your progenitor cells. They're basically the cell from which everything else is formed. And stem cells are what lays the foundation, if you will, for other cells to come in and grow and and regenerate and repair and remodel. And so when we do low intensity shockwave therapy to the penis, magical things happen. It activates stem cells in the penis. And what do those stem cells do? They create new blood flow called angiogenesis. Okay. And there are over a dozen studies. This is scientifically shown and demonstrated both in vitro, meaning in the lab, as well as in vivo in patients, in people, in men, that it actually improves blood flow and improves sexual performance. It improves sexual satisfaction. It improves quality of erection, as well as objectively quantifying when they look at objective ways of characterizing sexual function. So that's a great treatment as a regenerative approach for actually fixing the underlying problem. We also have PRP. PRP is platelet-rich plasma. Now, what that means is we'll draw a man's blood. I'll put it in a centrifuge. I'll spin down that blood. I'll separate out the different factors of the blood. The red blood cells go to the bottom. The serum goes to the top. And right in the middle, the buffy coat is full of amazing growth factors. Okay, these are your platelets. And you have platelet-derived growth factor, as well as a bunch of other interferons and other interleukins that are growth factors, chemokines, for having the similar effect that the low-intensity shockwave has, and that is to activate the formation of new healthy blood flow. And so I love the combination of doing the GAINSwave low-intensity shockwave therapy treatments with the PRP treatments together, and they have a synergistic effect. I also combine with those a vacuum pump use on a regular basis as well to help activate it and increase smooth muscle activation. And I like to say use it or lose it definitely applies in this situation, so you got to use it. So those are the different options for ED locally.
Is it for people only who are let's just say you're just having a slight problem?
Yeah.
Is this something you have to kind of wait until you're having a real problem?
Yeah,
I mean,
great question. The earlier you do it, the better.
Gotcha.
I've seen men who are having just a little bit of problem, and for that, actually, I have a home device actually that guys get that has a lower intensity, lower power level than the treatment in the office that they can do to enhance performance as well. It's pretty amazing, called the Phoenix. But the treatment is much more effective for guys who have very mild symptoms. As your symptoms get worse and worse on the scale, as your degree of sexual performance issues worsen, the efficacy will worsen as well. And so that's why I like to tell guys the earlier you get in and get on it, the better result you're going to have. If you wait until you're having no erections at all, you can't get it up whatsoever, much more difficult to get you going again at that situation.
That's perfect. You mentioned, so thanks for that, because so many guys are like raising their hands. Can I sign up? So,
Yeah.
And I think it's going to provide hope. When you talked earlier about genetics and things, I'm assuming that's what you meant by precision medicine, or is that something else?
No, you're spot on correct. Yeah, precision medicine is a term that's been coined to really describe using genetics to individualize health. Now, there's pharmacogenetics, which looks at how your body might respond to different drugs, which ones you might have a more difficulty metabolizing. There's genetics related to cancer, and if you have a certain either breast cancer, colon cancer, prostate cancer, whether you're going to respond to certain treatments. But I use genetics in a very precision way to optimize your health, helping you understand what you should eat, what should you not eat, what supplements might you need a little additional support, what type of exercise is right for you. Your genetics actually help us understand whether you're going to respond better to interval training versus strength training, for example, or endurance training.
Amazing.
That's awesome. So it takes the guesswork out of optimizing health, and that's where I love using genetics.
All right, cool. Real quick. Okay, a lot of products out there that are not, legit. So is there a way for my listeners to, or any advice you would give about, products that claim miracle cures, how to avoid the ones that are really not worth their time or money?
Supplements in general? Yeah. So, I get a lot of men who come to me for peptides. Peptides is one of the biggest features or offers in my practice that men love. And I get this a lot where guys will buy them from various direct to consumer companies out there, and a lot of them are crap. And so I'm glad you asked this question. The answer is really you got to work with a professional who has vetted and sourced the supplements, the peptides, the hormones, whatever it may be. There's a lot of, it's a wild west out there. There are a lot of guys guessing and doing what they think is right based on bro science and what they heard from their buddies, or this company emailed me with a discount coupon for this supplement or that. Do your homework, do your research, work with a professional like you and me, someone who knows what they're doing and can vet the source of the supplements or peptides properly.
That's a great answer. My second to last question for you. My podcast is about treating the entire person, and that's why I have the acronyms. And the rope has relationships as part of it. The T in the nest is a trauma. We mentioned that earlier. The E in the rope talks about your emotions and making sure your life experiences serve you. So your thoughts on the importance of treating the entire person rather than just focusing on the medical condition?
Yeah. Yeah, this comes back to a comprehensive systems-based approach, and that's where my male protocol comes in. And it starts with mindset. One of the things that we didn't get to touch on very much, but I'll just briefly mention is a lot of guys, it starts with mindset because a lot of guys don't really know where to start. They don't know what to do. They're overwhelmed. They're frustrated. There's so much noise out there right now of do this, do that, take this magic pill, as you mentioned, do this magical fat diet. And I like to ground men on starting with, what is your why? What's your purpose? Why do we care? Why should I care? Why should you make the effort? Because it's hard work to optimize your health and to function at optimal levels. It takes hard work, and there's going to be a time where you're like, why am I doing this? What the hell's the point? It comes down to living with intention based on your why, and that's your shining, your North Star you can always come back to when times are tough. And so understanding, first of all, what are your goals, number one, but what is your why, and living with intentions that everything you do is in alignment with that is going to help you with the rest of the process.
Yeah, and that's how I've found that I can help patients move the needle when I understand their why. And I feel like a therapist during half my visits, but
Right?
it's
Yeah,
important that
exactly.
we hear them and we ask them to answer that question. So the last question I have for you is this ideal of my nest and rope: nutrition, exercise, less stress, more sleep, how we think, avoiding trauma or recovering from it, and making sure our relationships serve us for the rope, and avoiding organisms and pollutants that harm us. And then, of course, making sure your life experiences serve you and protecting your emotions. So when you think about your next 12 months, as we are hopefully getting out of a pandemic soon, where do you want to focus so you can optimize your life?
Yeah, thank you, Tony. I honestly come from a place of service, and I'm at a place now where I'm working on a TED Talk to share my message. I'm working on a nationwide men's health campaign to focus on going beyond testosterone and really battling this men's health pandemic that's not getting the attention it deserves. And so I'm really passionate and dedicated to shining a light on this and giving it a voice.
Well, we appreciate you. And again, if my wife hasn't ordered your book yet, uh, I'm sure a lot of people listening would love to hear how to find you, your work, and of course, how to get your book. What would you share?
Oh, you got it. Thanks so much. So my website is drtracygapin.com. That's DR for doctor. And I'm offering your listeners a free copy of the book. It's Male 2.0, Cracking the Code to Limitless Health and Vitality. I'll just cover the shipping. And you can go to drtracygapin.com/limitless.
Nice. What a nice gift. I know we'll be getting close to Christmas soon. So
That's right.
I
Check it out.
appreciate that and really appreciate you. So thank you so much for being here and providing some insights on a topic that we have to talk more about. So I'll say a few closing comments. So thanks again for enlightening us on this topic. I mean, so many people need answers and really have given up, some of them, because they just never thought they'd regain their sexual health. So if anybody's listening to this episode or viewing it on YouTube, make sure to take advantage of the resources shared by my wonderful guests. It's a conversation we need to have, and there's really no reason to deprive yourself and your partner of having the type of sexual life you both deserve. So make sure to get the help you need. And if you know anyone who needs to hear this message, share this episode with them and the resources that my buddy here is sharing today. So thanks again for all those who have joined us for today's episode. And as I conclude, I ask you be safe, be well, and continue to protect your nest.